Hi, it's Dre Griggs with Obsidian Wisdom. Today we discuss all the details about the Medigap coverages or the Medicare Supplement Plans. When it comes to the Medicare Gap or Medicare Supplement Plans, these can be used with your overall Medicare plan. It's important to know that this is not Medicare. And what that means is these programs are offered by private companies. I'm going to go through how to read the charts because, as you know, the charts can be a little complicated. And we'll go through some of the examples and we'll even pull up some rates to give you some overall ideas. As you can see, now we're here on Medicare.gov and we can compare the Medigap coverage plans. I'm going to move myself actually up here so that we can see the charts a little bit better. And you'll see that they have plans A, B, C, D, F, G, K, L, M, and N. When it comes to these Medicare plans, the majority of you are going to choose between G and N. At least that's currently the way it is. And we'll talk about why people who do choose the Medicare Gap coverages choose those two options most of the time. Now, some of it has to do with the fact that a lot of these are just not offered in every state. And sometimes the ones that are, the price that they charge you, it doesn't make a lot of sense based on the coverage that you're getting. So we'll go through each of these so that you know how to read this chart when it comes to deciding what makes the most sense for you. So first and foremost, what you'll see here is we have the Part A coinsurance and hospital costs up to an additional 365 days after your Medicare benefits are used up. So all that means is when you come to Medicare Part A coinsurance, you're going to be paying 20% when it comes to all of those hospital expenses after you pay your deductible. And from this chart here, you can see that your deductible for 2024 for Medicare Part A, it is going to be $1,632. That is an increase from about $1,600 last year. And then what you'll see is you'll have your daily hospital coinsurance that starts on the 61st day and goes until the 90th day. And that is $408. So you pay that every single day. So as you see, that can add up relatively quickly. Next, you'll see that you have your daily hospital coinsurance for lifetime reserve days, and that is $816 a day. Now, you may be asking, well, Dre, what is my lifetime reserve days? What that is if you're in the hospital for the first 90 days, you have this amount of payments, or at least this is what your rate is. If you're in the hospital after the 90 days, you will then be charged $816 per day. And your lifetime reserves is what we call those additional 60 days that you're in the hospital. And then after that, you just have your skilled nursing facility. And that's just what it sounds like. It's something that you need a skilled nurse. It could be 24-hour care. And whatever that looks like, you have up to 21 to the 100 days, and you'll pay $204 for each day. And so now that you have a better idea about the numbers that we're talking about, you can see how the Part A coinsurance and the hospital costs up to an additional 365 days after your Medicare benefits are used up is something that if you are having a long-term care issue, or if you're just in the hospital for a long period of time, that this could be something that'd be very beneficial for someone to have. And that's why in most of the Medigap plans, this is something that's provided in every single one of them. This is the bare minimum that most people are looking for. Most people expect their Medigap to help them pay where their Medicare is falling short. And then we'll move on to the next one. The next one is your Part B coinsurance or copayment. And you'll see that this one's actually a little bit different. So while the majority of them offer some sort of coverage, they don't all offer complete blanket coverage. And you'll see how Plan K only offers 50% coverage. You see how Plan L is only willing to pay 75% of the coverage. And when we're trying to figure out how to read that, it tells you right here on the top with the percentage. It says the plan covers that percentage of this benefit and you're responsible for the rest. So it's exactly what it sounds like. They're going to cover 75% of this cost of your Plan B coinsurance or copayments, and then you will be responsible for the rest. And then you'll see over here in Plan N, let me move myself maybe to the middle or to the side because I'm still kind of in the way, maybe to the side, I don't know. But you'll see here with Plan N, it has the 3 stars. If you go down to the bottom, it tells you there's 3 stars. It says Plan N pays 100% of the cost of Part B services, except for copayments for some office visits and some emergency room visits. So that's just for you to understand that is going to be the difference between G and N as far as one of the differences, but you'll see the rest of them also cover it. And when it comes to your Medicare Part B premium and deductible, you guys know from the other video, and I'll put a link to it, that your Part B is $174.70 for 2024, and that is going to be for the majority of people. Now, there is a table where if you make over $103,000 a year, that you wouldn't having to pay slightly more than that, and it goes up on each of the brackets. And next, you'll see that your annual deductible for Medicare Part B is $240. So that is what your deductible is. $240 is what you would expect to pay out of pocket before you even start talking about your coinsurance or any of these other coverages. Now, your coinsurance for Medicare Part B is very similar to Medicare Part A in the sense that it's set at 20%. So once you pay your deductible, you would then expect to pay about 20%. When it comes to your copays, that is not a percentage. So it's not 20%. It's just a flat amount. So it could be like $20 to visit the doctor. It could be a $50 copay, whatever that copay is. And then based on whatever services and treatments you receive, you can then expect to pay some sort of a coinsurance where, as we mentioned, it's about 20%. When it comes to that, now you can see, okay, well, that is where these benefits are going to help me out. If I don't want to have to pay that 20%, if I'm just looking for a little bit of certainty where I'm not as worried about, well, if I go to the doctor a bunch this month, but I don't go as much that month, it kind of smooths out what your overall monthly payments will be. But it really depends on you and how healthy you are, how often you go to the doctor, because you could be paying maybe $200-$300 every single month, but you don't really go to the doctor. Where maybe if you just paid that 20%, it would have made a little more sense for you just to take that option. It really is a tough decision for many of us, but it is one that really depends on our personal situation, what makes the most sense for us. And then next you can see getting the first 3 pints of blood. Again, you can see that plans A through G cover that. And then you can see K through L offer those same percentages, 50% all the way down for plan K, 75% all the way down for plan L. And then you can see that plan M and N cover that as well. Next, you'll see the Part A hospice care coinsurance. Hospice is normally if you are aware that you're going to pass in a relatively short amount of time. And the number one goal at hospice is to make sure it's as painless as possible of an experience. They're not necessarily concerned about helping someone heal. The assumption is that this person has something that they can't heal from, but we just want to make sure that they don't have any pain that they're dealing with. And so hospice is something that can be relatively quickly, but it could be a long period of time. There are cases where people are in hospice for months at a time. Now, it's not super common, but it does happen. And if you're just looking for some certainty around that, again, these plans offer that option as well. Next on the list, we have skilled nursing facility care coinsurance, and you'll see that Part A and Part B do not cover your skilled nursing care, but you do see that C, D, F, G, K, L, M, and N, that they do cover the same amounts that they have. But you'll notice that you don't have that long-term care help that you may be looking for in your Medigap coverage if you were to choose Plan A or Plan B. Next, we have your Part A deductible. That's that $632 that we talked about in Part A that you would have to be paying for, and then you have this additional 365 days up here. Well, this amount actually covers that, so they go nicely together for some of the options. So Part A, you would actually still pay the deductible. It's not covered in Plan A, and then from there, you'd have this additional coinsurance and hospital cost for an additional year of help. Now, when it comes to the rest of these, you see that plans B through G do pay the entire amount of your deductible. So that $632, that is paid through the plan, and then half of that is paid in Plan K, and then you have 75% of that paid through Plan L. And then we're back to 50% for Plan M, and then Plan N covers the entire amount. And then when it comes to the deductible of Plan B, you'll see that the majority of them do not pay that $240. The only two that we're paying it is Plan C and Plan F. The rest of them don't cover that. And then Plan B, the excess charge. Well, first, let me just say that the excess charge is not that common. And what it is when you're inside of Medicare, there are doctors who agree to receive Medicare patients. So when the Medicare patients come, most of the doctors agree to pay whatever the Medicare arranged number is because they're in the network already. But there are some doctors who will receive Medicare patients, but they don't agree to pay whatever the set cap is that Medicare has, and they will charge you over what Medicare would bill you. Now, they do tell you when you go through the screen and you look up to choose your provider, where it says that this person agrees to bill you whatever Medicare has already said is the amount. Now, Medicare allows these companies to charge over 15% of what they have, and they can still be within the Medicare network. They just won't be one of those preferred providers that says, I'm going to bill you what Medicare says you should be billed. So because they could charge you over that, that is what's called the excess charge. Now, most of the times, if you're a doctor and you want to charge more than what Medicare has set, you're not going to go through the hoops of joining a Medicare as a provider. So you can then charge the 15% more. You're just going to see patients that aren't a part of Medicare, and then you'll be able to charge whatever the amount that you want is. That's why the excess charge is not very common, but it is true that if you did see a Medicare provider and that doctor charged you more than what Medicare says, that you will be responsible for that excess charge. And with that said, if that was a concern of yours, plans F and G are the only two that give you the opportunity to be able to have that excess charge covered. And then the foreign travel exchange is just if you need some help from a doctor while overseas and just living your life and enjoying your vacations. You can see that plans C through G offer 80% coverage. Plans A, B, K, and L don't offer any coverage. And then plans M and N both offer you 80% coverage for your foreign travel exchange. Just to get another feather in the hat, just another way to be confident when you're traveling that you have everything taken care of and you don't have any unexpected expenses. And then your out-of-pocket limit is just as it sounds. That means the maximum that you can pay in any given year. And you can see that none of them really offer out-of-pocket limits except Plan K and Plan L. And you can see the max amount in 2024 is $7,060 for Plan K. And then you can see the max amount that you pay out of pocket for Plan L is $3,530. So let's go ahead and let's do some housekeeping where we'll do some cleaning around on some of these numbers. First and foremost, you'll see the note. It says Plan C and Plan F are not available anymore if you turn 65 on or after January 1st, 2020. So those plans are not available. So that is Plan C and that is Plan F. When you look at the way it used to be, the majority of people chose Plan F. And you can sort of see why. Plan F checks off all the boxes and it covers 80% on the traveling. That was what everybody loved. You can't go wrong with Plan F, and a lot of people felt really good about that. Now, when you look at Plan C, you can see that it doesn't have the excess charge, but it did cover everything else, and so people enjoyed that plan as well. But Plan C is also gone, which is why the majority of people who are looking for certainty when they're looking at these Medicare supplement plans, they often lean towards choosing either Plan G or Plan N. And we'll make another video where we go into detail about the differences between the two. But just based on what we've gone over so far, you can see that the main difference between Plan G and Plan N is first and foremost your coinsurance. It's first and foremost your Part B coinsurance or copayment. On Plan N, you have that small carve out where it says except for copayments for some office visits and some emergency room visits. So inside of Plan N, it's possible that you'd have to pay that out of your pocket. And then when you move on to the rest of it, you can see that as far as the deductible for Plan B, neither of them cover that. You can also see when it comes to the Part B excess charge, that's actually covered under Plan G and is not covered under Plan N. Again, it's not very common, but if it is something that you were looking for, that is a difference in the two plans, and it may be worth that additional charge of Plan N if you wanted to make sure that excess charge was covered. They both have the 80% on the foreign travels, and neither of them have the out-of-pocket limits, which is why the majority of them choose them. Another housekeeping matter is plans F and G offer a high deductible plan in some states. So it depends on the state that you're in. And because these are privately offered, you'll go onto these websites. You can Google it, or you can just go to your Aetna or your United Healthcare or any other provider, and they will let you know what the options are for you as far as what they offer. And I'm going to give you a couple examples before this video is over. But a high deductible just means that you pay a little more out of pocket on the front end, but your monthly premium is going to be a lower amount because you're sharing in the risk with the healthcare provider. And then you'll see plans K and O show how much they'll pay for approved services before you meet your out-of-pocket yearly limit and Part B deductible. After you meet them, the plan will pay 100% for approved services. And when we say approved services, we're talking about Medicare approved services. So it's important to note that even though your Medicare supplement plan is offered by a private insurance company, it doesn't mean that they won't be accepted. And what I'm saying is, if you go to a doctor who accepts Medicare, but maybe they don't accept Aetna, just because you have an Aetna supplement plan, they're not going to decline your Aetna supplement plan. They're going to accept it because they accept Medicare. They go together. So you'd give them your Medicare card, and then you'd give them your Medigap or your Medicare supplement card, and they would be both accepted and work together. Because what happens is the doctor is going to say, okay, your Medicare covered this amount, and then whatever is left, your Medigap or your Medicare supplement card will then cover that. They don't really care who the provider is. And the same would be true if you went to a doctor that was like, yeah, we don't accept United Healthcare, but your supplement plan was United Healthcare. Well, that doesn't matter because they're just accepted everywhere that Medicare is accepted because it goes with your Medicare. And the last thing I'll do is I'll show you a couple real examples of what the Medicare supplement policies will look like and what you would be looking at. So I just put in Google Medicare supplement plans, and I just clicked on the first two that didn't require a ton of information from me. And you'll see the first one here is a Florida Blue Medicare Supplement Plans. And you'll see here that they give us the options of the supplement plans. And you'll see that they offer Plan A at $192.40 a month. And you already know based on what we saw here that Plan A is going to be able to cover everything except our skilled nursing facility coinsurance, a deductible for Part A, Part B, the excess, and the foreign exchange travel. They don't have anything for that either. When you then look at this, it says, okay, well, based off of that, this is $192.40 per month that you would have to decide if that makes enough sense for you to cover. Basically, again, it's determining how often you're going to go to the doctor, what your average bill is going to be, and then what 20% of that is going to add up to. And then you can decide whether that makes the most sense for you to get yourself a supplement plan or whether it makes the more sense for you to pay out of pocket. When you look at that, that's where we would start at. You then see that their plan B is at $231.50. So we'll go back to our chart and you see that the difference between plan A and plan B is plan B offers me the ability to cover my part A deductible, which is $1,632. Outside of that, they are the exact same. So does it make sense for me to pay an additional $40 a month to have $1,632 of coverage if I plan on using my deductible? And in that particular case, the math would say, well, yes, that would make sense. If you spent $40 a month, that would be about $500 a year of extra payments to then cover that $1,632. So if you were choosing between plan A and plan B, it would make sense for you to go ahead and get plan B, because if you already believe you're going to go to the doctor enough for your coinsurance to make sense to make the payment, then it definitely makes sense based on the deductible for you to not worry about plan A and just to choose plan B. Then when you move on to plan C, you see plan C is $267.30. Well, let's take a look back at our chart. We can see that plan C also covers a deductible for part B, and then it also covers up to 80% on the foreign travel exchange. So this one covers a little bit more. And then depending on how much you want to travel and whether that $240 makes sense for you, we would say, okay, well, if I'm going to pay an additional $35 a month, does that make sense? And the $35, it basically covers what your deductible is. So if you weren't planning on traveling, then paying the Part B deductible would just make sense to pay it out of pocket, because you're going to ultimately end up paying more than that $240 deductible. Now, granted, you may say, well, Dre, what about the deductible going up each year? That's true. Your deductible could go up more each year, but it's also true, just like all healthcare plans, that amount could go up each year as well. And depending on the underwriting process, we've all worked at places where the health insurance from one year to the next can go up 10, 20%. So it's not a guarantee based on the amount that you do have here set aside. But it's, again, just something for you to be considering. Part D is lower, so it's at $251.40. So that makes it lower than Part C, but it makes about $20 more a month than Part B. And what you'll see here is that Plan D is the same as Plan C, except the only difference is you'll see we're no longer covering our deductible for Part B, but we are still having the foreign exchange travel. So if you're someone who plans on traveling and you just want to have that extra layer of protection, but then at the same time, you also don't feel that your deductible being at $240 for Part B, and then you're paying an additional $300 to cover that doesn't make a lot of sense mathematically. Well, then Part D gives you the option of saying, okay, I will pay my own deductible for Part B, and then you will help me with my travel expenses. Now, the difference between, if you were someone that's like, all right, well, what's the difference between B and D? Because I already had that. Well, B, you see that you weren't getting the skilled nursing facility coverage, but in D, you were able to add that on here. And that was the same with C. I can't remember if I actually mentioned that one or not, but you see it also covers that skilled nursing facility. And so now that you have that additional coverage, well, that amount is $251. So depending on where you're at, I personally, if I was choosing between C and D, I think I would choose D for me. But if you're someone who feels like you really want to make sure that your deductible is covered and you just don't want to have to think about it, then you could choose C, but they do charge you a little bit more for that. And then we'll move on to see they have Plan F available. So Plan F is $271. Now, we mentioned Plan C and Plan F aren't available if you turn 65 after January 1st, 2020, just to make sure we're on the same page. But Plan F checks off all the boxes, so you don't have to think about it much at all. Everything you know is pretty much going to be covered, and so you just would make that payment of $271 a month, and then you would have like a set it and forget it mindset. And that's why a lot of people like Plan F. It's also why a lot of people like Plan C. It has that set it and forget it feel. But again, we don't have those options available for us anymore if you're someone who's turning 65 after 2020. So then we'll keep moving. We'll see Plan G. So you can see now why a lot of people like Plan G. It's $241.60. Now, if you look at the other numbers that we've gone over, the fact that my Plan G covers everything except my Part B deductible, which again is only $240 in 2024, and then everything else is covered, that's lower than most of those plans that we just talked about, which is one of the reasons that people really enjoy Plan G and why the majority of people have Plan G who have the Medicare supplement plans. Obviously, some people have the Medicare Advantage, but if you have a Medicare supplement plan, the majority of people are going to have the Plan G and the Plan N. So then when you go into Plan K, you guys remember Plan K and Plan L do not offer a significant amount of coverage. They just help you with some of the overall percentages where you're splitting the bill with them, but they don't give you a lot of those additional coverages. And as a result, you do get to save a lot if that's someone that's like, you know what, I want to hedge myself a little bit, but I don't plan on going to the doctor a lot. So I feel relatively safe. Then you may say it makes sense for you to just pay the $85 a month, and then you get that half of the coverage that you would be looking for. And then you move on to Plan L. Remember, the big difference between Plan K and Plan L is Plan K covered 50% and Plan L covers 75%. So for the additional 25% of coverage, you are going to pay closer to $160. So it's almost double the price to get that additional 25% of coverage. But again, it's all about your budget. It's all about how often you believe to go to the doctor. Then we'll move on to Plan M, and you can see that Plan M, so we're getting to the end. So Plan M, as you see, it covers everything. Your Part A deductible and covers half of that $1,632. It does not help you with your Part B deductible. It does not help you with your Part B excess charge. But again, the excess charge isn't that common. That'll be $231.90. Based off of what we just saw, when you look at Part G at $241, which does cover all of that, it really would be hard to say, I'm going to choose Plan M. It's not that you couldn't choose Plan M. It's just compared to the other options, some of them just don't make sense to choose. And then Plan N is the other option that is commonly chosen that people really do enjoy, and you can see why. It's $200.10 with this Florida Blue option, and the only main difference between Plan G and Plan N is, one, as we mentioned, it does not necessarily cover all of your co-payments for some of those doctor visits and some emergency room visits. Now, it's not super common, but there are some exceptions that they carve out, and then it does not help with the Part B excess charge, which is also not very common. But if you did want to make sure that that was covered, your Part G does cover that. Then the excess charge, just as a reminder, is just you go to a Medicare doctor and that doctor charges you more than the Medicare set amount. You have to pay whatever the excess of that is. That'd be $200.10. So you can see why for the majority of people who are considering using a Medicare supplement plan, it just makes sense to choose really between Plan G and Plan N. Now we'll end with some of the pros and cons of the Medicare supplement plan. So you guys already seen, we went over the nuts and bolts. You know how to read the chart, how to choose what makes the most sense for you. But when it comes to the pros and cons, so some of the pros, and I'm pulling this from a CBS News article, some of the pros is you have the freedom to choose your providers. Medicare supplement insurance allows you to choose any healthcare provider who accepts Medicare. You are not restricted to a network of doctors or hospitals, giving you the flexibility to receive the care from the healthcare professionals you trust. Medigap policies are guaranteed renewable. This means that your policy can't be canceled by the insurance company as long as you pay your premiums on time. This insurance provides you peace of mind, especially if you develop health issues over time. No referrals are required. Unlike some Medicare Advantage plans that may require referrals to see specialists, Medigap policies generally do not have referral requirements. This means you can consult with specialists directly without needing your primary care physician's approval. You have the travel coverage that we've gone over. Many Medigap plans offer coverage for emergency medical care while traveling outside the United States. Now we'll go over some of the cons and things you need to consider when deciding whether Medicare supplement insurance makes sense for you. Number one is the premium cost. While the Medigap policies generally cover extensive coverage, they also come with higher premium costs. In addition to your standard Medicare premiums of Part B, where we talked about $174 a month, you'll need to pay a separate premium for your Medigap policy. And these costs can add up, making it important to budget for your healthcare expenses. You have limited prescription drug coverage. Your Medigap plans do not cover prescription drugs. For prescription drug coverage, you'll need to enroll in a standalone Medicare Part D plan, which can range from about $15 to maybe $30, $40 a month. And this means that you have multiple insurance plans to manage, which can be confusing for some of us. Unlike Medicare Advantage plans, which we'll do another video on, which often include additional benefits such as your dental, your vision, and your hearing coverage, Medigap policies focus solely on filling the gaps in your original Medicare. If you're looking for extra healthcare related benefits, you will need to explore other healthcare options. You have enrollment period restrictions. To purchase a Medigap policy without medical underwriting, you must enroll during your Medigap open enrollment period. Missing the window for your open enrollment period may result in you having to pay higher premiums or overall denial of coverage if you have pre-existing health conditions. And for those that aren't aware, your Medigap open enrollment period is a one-time 6-month period that starts the first month a person is 65 or older and they have Medicare Part B. During this time frame, as long as you meet both of those requirements, an insurance company cannot refuse to sell a Medigap policy. And it's important to note that after this period, your options to buy a Medigap policy may be limited and the policy may cost more. Another con is the state variations. As we had mentioned earlier, Medigap plans are standardized at the federal level, which means if you get a Plan G in Florida, it's the same Plan G in Georgia, it's the same Plan G in New York or California. That is standardized at a federal level, but availability and pricing is what will vary state by state. And so it's essential that you research the options specific to your location so that you know exactly what you're getting into with a Medicare supplement insurance policy. So the bottom line is your Medigap or your Medicare supplement insurance policies are pretty valuable resources if they make sense for your budget and if you plan on using these strategies in your healthcare plan. Choosing which one makes the most sense for you will vary. It depends on a lot of individual factors, your overall health, the state that you're in, how the age that you are, what you've already chosen. There's so much that goes into it, but at least you have a better idea of what you're deciding when you're making that decision. If you have any more Medicare questions for me as I continue going through our Medicare series, you can always feel free to leave a note in the comment for me. As always, I am thankful for our time together. I appreciate you giving it to me. This video was a little bit longer than I was intending, but I really wanted to go over the information in as much detail as I could without you feeling overwhelmed. Hopefully you didn't feel overwhelmed. Fingers are crossed. If you found value in this video, go ahead and like and subscribe so you can continue receiving valuable insights on how to unlock your own wealth retirement system. So that way you're not worried because you're unprepared for retirement, but you're confident and happy because you exactly know what's going to happen. Until next time, stay safe and enjoy life.